started looking at him and just assessing the situation. Youngish guy, probably in his 40s, clammy, had some bluish tint around his lips. And immediately I knew this is a guy who I should be using Narcan for, and I had nothing. I had my phone, I called 911 and sat with him and tried to arouse him, but I didn't have it. So just a cautionary tale. Pick one up. It costs nothing. They're offering for you. I'm sad to hear that Pennsylvania pharmacies are charging for that. In New Jersey, it's actually free. You can go to a pharmacy in New Jersey and they will give it to you. So.
Within your time as a physician, how would you say the insurance coverage has changed and it impacted your role as a physician as well as patient care?
So insurance coverage is an issue that plagues our country. When President Obama was in office, love him or hate him, he did something really amazing for us. He pushed through legislation to offer Obamacare, or the Affordable Health Care Act. And that opened the door for a large swath of people to have some coverage where they had none. Prior to that time, healthcare emergency was the number one reason for bankruptcy. Number one reason for bankruptcy. Very easy. You only need one hospitalization. Nobody has $100,000 sitting in wait for the emergency. So it has really changed how people access healthcare. They have the ability to access it earlier without so much worry and trouble. And people who find themselves in an emergency are not stressed at their bedside, not focused on healing, but focused on how am I going to pay these bills. So it has really opened up a whole world. Obviously, Pennsylvania has the CHIP program for kids where they are automatically covered. I also did a fair portion of my career working in a federally qualified health center. Those are health centers that are funded by the federal government to offer care for those who are underinsured, uninsured, undocumented. And so a large part of my work has been to make sure that people who still and yet don't have insurance, maybe because they are undocumented or haven't had the time or priority to get insurance, that they have health care. Healthcare is so important. It's so important. It's so difficult to operate in this world without having it. And that is from firsthand knowledge for caring for patients who don't have it. Does everybody have healthcare insurance here? Is everybody covered under a plan? Coverage, 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 coverage. Coverage, yes. Coverage, no. Coverage, sort of. Coverage, yes.